10 TV is working to beat the stigma when it comes to addiction and mental health. And we all know someone who battles with a mental health or a substance abuse disorder.
Yeah, this issue became more prominent during the COVID-19 pandemic, and many people simply don't know where to turn for help.
Monica Robbins at our sister station in Cleveland has a few ideas to help beat the stigma.
I was young. I got prescribed ibuprofen for an oral surgery that I had.
Aaron Mark's story echoes thousands.
But for me, it was kind of like grabbed hold of me. And within a really short period of time, I became addicted to them.
But like many, Aaron's addiction escalated.
Next thing you know, I'm alone and I'm, IV drug user within a short period of time.
Substance disorders are common. And you're not alone.
His friends and family worried.
It never hurts to ask someone that you love, how are you doing? I'm worried about you, and I want to talk about something I've noticed.
Aaron heard their concern, and when he was ready, had a lifeline.
When things really hit bottom, I was able to pick up the phone and call and ask for help.
But it can take time.
Every single person is different. Every single person responds differently to everything.
And when people get engaged with treatment, they tend to do really well. The biggest problem we have is getting people engaged in treatment.
But there are efforts to make it easier. This summer, the National 988 Mental Health Helpline opened as a portal to resources.
It's a number people can use for substance use disorder problems of any kind or mental illness problems of any kind.
If you or a loved one might need help, Dr. Runnels advises keeping a list of local resources and make that first call, even if it's just for information.
And I often say to people, take the first next step. It's hard to know where this journey is going to go, but it never hurts to go sit down with someone and just get an assessment.
The pandemic showed us a glaring need for more mental health professionals. Telehealth is a convenient option.
Virtual health is largely able to accomplish in the world of mental health and substance use disorders a lot of what we could do in person, and it is often a perfectly viable model for a lot of things.
But in times of crisis, there's help too.
And if your needs are on the more dire side, if they can't wait, almost every provider is figuring out ways to get those people in and prioritize those people.
Aaron, now 18 years in recovery, has a wife, a successful career, a strong support network, and uses his experience to help others and beat the stigma.
I'm not ashamed of my experience. I don't hide from my experience.
Now, join us for Beat the Stigma, Recovery is Possible, tomorrow night at 9:30. We'll expose negative beliefs and attitudes about people who are in recovery and introduce you to people who have made the journey from addiction to recovery.